So y'all know that I love these birth rate videos because I am on team let the birth rate plummet to hell. So right now we are talking about Japan, and Japan's fertility rate hits record low. I don't like it that they use fertility rate because women are opting out on purpose. That's why I say birth rate. Let's jump into it. It says Japan's fertility rate declined in 2024 for the ninth consecutive year, reaching another historical low that underscores the immense challenge facing the government as it attempts to reverse the trend in one of the world's most aged societies. The total fertility rate, the average number of children a woman is likely to have over her childbearing years, fell to 1.15, down from 1.2 the previous year, and marking the lowest rate in records going back to 1947, according to a health ministry release on Wednesday. The trend was particularly notable in Tokyo, where the rate was below 1 for the second year in a row. The total number of births dropped to about 686,000, marking the first time the figure has fallen below 700,000. Deaths totaled around 1.61 million, leading to a net population decline of roughly 919,000 and extending the run of annual drops in the country's population to 18 years. Jeez. That data excluded migration. The data underscored the urgency of the government's recent push to boost fertility. Prime Minister Shigeru Ishiba has rolled out a range of policies aimed at easing the financial burden on families, including expanded child-related subsidies and tuition-free high school education. The government has also guaranteed full wage compensation for some couples who both take parental leave and improved working conditions for childcare and nursing staff. These measures build on the initiatives by Ishiba's predecessor, Fumio Kishida, who pledged to raise the per-child government support to levels comparable to Sweden, where 3.4% of gross GDP is devoted to family benefits. At the time, Kishida warned that Japan could lose its capacity to function as a society unless bold action was taken. The crisis of rapidly declining birth rates remain unresolved, a health ministry spokesperson said, citing the shrinking population of young women and the trend toward later marriage and childbirth among key contributing factors. The continued decline in births is renewing concern over the future of Japan's social security system. The nation's public pension program is under increasing strain, with fewer contributors and a growing number of recipients. Over the past 2 decades, the number of people paying into the system has fallen by around 3 million, while beneficiaries have increased by nearly 40%, according to a separate ministry report. Japan's soaring Social Security costs are placing even greater pressure on public finances, where the debt to GDP ratio stands at the highest among advanced economies. For fiscal year 2025, social welfare spending totaled around 38.3 trillion yen, that's around $266.3 billion, accounting for 1/3 of the national budget. Labor market is also expected to remain under pressure. If current trends continue, Japan could face a shortage of 6.3 million workers in 2030, my goodness, according to an estimate by Persol Research and Consulting. Demographic challenges are increasing around the world. In South Korea, the fertility rate ticked up slightly last year for the first time in 9 years, though only to 0.75, still well under 1. Births in the United States declined in 2023 to the lowest level in more than 40 years, a trend that likely led to the Donald Trump administration considering a raft of child care policies, which were dumb policies that were not really thought out. In a rare encouraging sign, the number of newlywed couples in Japan rose by more than 10,000 in 2024 compared with the previous year. Since marriage and birth rates are closely linked in the country, the increase may help support future fertility. Local governments, including in Tokyo, have recently launched initiatives to encourage marriage, such as developing dating apps and organizing matchmaking events to create more opportunities for people to meet potential partners. As I sit up here and read these articles, I'm reading them as I'm reading them on video. I don't really pre-read them. I am waiting for the time that they are talking about a shift in culture that would make women want to actually have children. Are they going to actually start supporting mothers? Are they going to reduce the work hours and make it feasible? What about the cost of living? They have an extreme work culture there. So when are they going to address all of these things? What about the culture of misogyny? Are they going to encourage dads to actually participate more in raising their children? I have yet to see I don't see them talking to women. I don't see them talking to women and asking, what would it take to make you have a baby? Or when would you feel comfortable with having a baby in our current culture? I don't see that addressed. So I'm still on team, let the birth rate plummet to hell. All right, so this is Japan. Let's see what other countries we can dive into. Now we're going to talk about Vietnam and their birth rate struggles. So this is an article from the AP saying Vietnam scraps two-child policy as aging threatens economic growth. Vietnam abolished its long-standing two-child limit Tuesday to try and reverse declining birth rates and ease the pressures of an aging population. The National Assembly passed amendments scrapping rules that limit families to having one or two children, state media Vietnam news agency reported Wednesday. The rules were usually stricter for Communist Party members who could miss out on promotions or bonuses if they had a third child. Vietnamese families are having fewer children than ever before. The birth rate in 2021 was 2.11 children per woman, just over the replacement rate required for the population to avoid shrinking over the long term. Since then, the birth rate has steadily declined to 2.01 in 2022, 1.96 in 2023, and 1.91 in 2024. Vietnam isn't the only Asian country with low fertility, but unlike Japan, South Korea, or Singapore, it's still a developing economy. Nguyen Tu Linh, 37, a marketing manager in Vietnam's capital, Hanoi, said she and her husband decided to only have one child because they wanted to give their 6-year-old son the best education and upbringing that they could afford. Sometimes I think about having another child so my son can have a sibling, but there's so much financial and time pressure if you have another child, she said. Vietnam introduced rules blocking families from having more than 2 children in 1988 to reduce pressure on limited resources after years of war, first with France and then with the United States, as the country transitioned into a more market-oriented economy. The population rose from about 62 million then to just over 100 million in 2023, the most recent year for which data is available. Vietnam's golden population period, when working-age people outnumber those who depend on them, began in 2007 and is expected to last until 2039. The number of people who can work is likely to peak in 2042, and by 2054, the population may start shrinking. All of this could make it harder to grow the economy, since there will be fewer workers while the cost of supporting the needs of the elderly increases. They are always putting a dollar sign on women's wombs, but they are not talking about how they are going to pay women for the sacrifice of having babies. They are always talking about, we need more workers, we need these people to support the pension, but they are not talking about what they are going to do to incentivize women to take on this sacrifice. Like I keep saying, I don't read these articles in full until I'm reading it for the camera, so let's see if they offer any incentives. It says birth rates in Vietnam aren't falling evenly. In Ho Chi Minh City, the country's biggest city and economic hub, the fertility rate in 2024 was just 1.39 children per woman, much lower than the national average. At the same time, nearly 12% of the city's population was over 60, putting pressure on welfare services. To help local officials started offering about $120 to women, $120 to women who have 2 children before 35 last December. $120. If anybody is out there who knows how far $120 will go, because I could easily go to dinner and spend $120 right now. That would not incentivize me to even wake up early, let alone have a baby. All right, let's keep moving. It also offers some of the most generous family benefits in the region, including 6 months of fully paid maternity leave and free health care for children under 6. Tuition in government schools is free until age 15. Starting in September, it'll be free until the end of high school. But this is where they messed up. Vietnam is also dealing with unbalanced gender ratio, partly due to long-standing preferences for sons. According to state media, the distortion is more concentrated in Vietnam's northern Red River Delta, which includes Hanoi. And that's the thing about these countries that prop up boy children, is like, y'all are doing this with absolutely no foresight. They've had all of these boys, and now as men, they won't even have anybody to partner up with because of these patriarchies that have no sense. They have earned this. They have earned this population crisis because these men in charge have no sense, no foresight, can't think things through, and now they have a whole generation of men that will, never partner up. This is their government's fault. This is the parents' fault for always propping up boys and men. Like, boys and men are way better than girls. They have earned this. Doctors aren't allowed to tell parents the baby's sex before birth, and sex-selective abortions are banned. But despite this, some still hint at the baby's sex using coded language, said state media VN Express, citing a government report. On Tuesday, the health ministry proposed tripling the fine for choosing a baby's sex before birth to $3,800, state media reported. So I'm still not seeing anything that's going to say, you know what, let's go out and have some babies. But you let me know. What do you see? Are you on team let the birth rate plummet to hell? Or are you on team, let's have some babies and such? So let me know in the comment section. Don't forget to like, comment, and share.